Hi, this is Dr. Bragg from the Spinal Orthopedic Pain Center with a tip for a pain-free Friday. In treating patients in pain over the past 20 years, one of the things I've come to realize is that a lot of people don't really understand the visual analog scale. That's the scale that goes from 0 to 10, where you're able to tell your doctor what your pain is. Sometimes people tell me, well, my pains are 20. Well, the scale only goes from 0 to 10. So today we're going to get a good understanding of this pain scale. So when you talk to your doctor, you can tell them in their terms, 0 to 10, what your pain is, so that you can enhance your communication. Obviously, 0 means no pain. 2 is an annoying or mild pain. 4 is an uncomfortable pain or moderate pain. 6 is a severe pain. 8 is horrible or very severe pain. And 10 is the worst pain you could imagine. When your pain is a 10, it's bad enough that you say, I need to go to the emergency room right now. So sometimes people will tell me, well, my pain is a 20. The scale only goes from 0 to 10. So it's best that you use what we're used to having so that we can enhance that communication. So look at here again. 0, no pain. 10 is unbearable, the worst pain possible. 8 is horrible pain. 6 is a severe pain. 4 is uncomfortable. And 2 is mild pain. So think about your pain before you go to your doctor so that you have an idea of what it is. So when they ask you, what is your pain? You want to know what makes your pain better and what makes it worse. And by telling us those things, it gives us a better idea of what we need to do when we're thinking about your treatment. So I hope that you find this helpful learning more about the pain scale. So sign up for my YouTube below, and I'll be back again next week with another tip for a pain-free Friday.